If you're healthy enough to have a baby, then you're healthy enough to be active post-op after liposuction. Hello and welcome to this edition of the Wise Medical Minute. Today I'm going to be talking about a subject that's near and dear to my heart, and unfortunately I haven't talked about it before. It was brought to my attention that we never addressed the question of how long after having my baby can I have liposuction. And yes, you can understand how a woman wants to get her pre-baby body back. So the idea is we don't have good science to tell us the answer to that question. So the information I'm sharing with you is based on some common sense, basic medical knowledge, and more than a little bit of experience. Now, the surgical literature is downright devoid of data or hard science on this subject. I did a bit of a search. Now, it's replete with opinion, but no hard science to support the positions that the different authors take. So those articles that you can find will mention arbitrarily 3 months, 6 months, 6 to 9 months. But I think this is a very individual matter, and what's appropriate for one lady after her baby is not going to be adequate for the next person who has her baby. So these are the things I have to consider when answering this question. Now, when a woman is breastfeeding, I won't do liposuction, period. I don't know enough about the multiple agents that we use to make the body contouring procedure experience pleasant. We use lots of medications to reduce pain, the high volume of lidocaine that we use. The cardiac dynamics, when you're putting large amounts of fluid in somebody's body, even though a healthy heart and a healthy pair of kidneys is going to pee it out in a day or two. But all of those dynamics are slightly different when breastfeeding. Not to mention, my biggest concern is a woman's metabolic rate is different when she's breastfeeding. Her caloric requirements are different when she's breastfeeding. So even if we found a way to make it safe with the drugs, we want that metabolic energy to go towards healing. And when her body's busy producing milk, I think, it can wait. The elective procedure of liposuction is never an emergency, even if there is a wedding in 6 months, okay? But the bottom line is we don't do it when you're breastfeeding. Now, what matters more is skin turgor. Now, some women gain a large amount of weight during their pregnancy. Other women barely gain enough to have a healthy baby. So it affects the skin of the abdomen in particular. And therefore, depending on the amount of weight gain, you may experience things like stretch marks. Some of that's genetically determined, and some of it's a function of weight gain. It's amazing. Some women can put on 25 pounds, take off the 25 pounds, and their skin looks like they never had a baby. And the next person will have a 6-pound baby and gain 40 pounds, and then wonder why they got stretch marks. But basically, those stretch marks are more than skin deep, and stretch marks do affect the procedure. So planning your procedure is an issue that has to consider things like stretch marks. Now, the other issue that might modify how long before or after a procedure can be done is whether or not a C-section was performed. There's a little difference in the way healing takes place of the abdomen after a C-section. So that is a factor where I would add a couple of months of healing. Maybe that's when I would wait 6 to 9 months before performing a procedure. Now, the other question that frequently comes up, and I'm of a different opinion than most folks on this matter, but should you lose weight before or should you lose weight after your liposuction procedure? And as you'll have possibly seen in previous recordings, the visible impact of losing weight after a procedure is exponentially almost greater than the visible impact before procedure. Same 5 or 10 pounds you lose after procedure, it'll look like you lost at least double and sometimes more. So that's an individual matter depending on the issues that come with the weight gain. So if the weight gain is modest, 10, 15, 20 pounds even, not counting the baby weight. But if, say, your weight before pregnancy and your weight 6 months later is 20 pounds different, then I wouldn't make it an issue as far as losing weight before a procedure. As especially worth considering when a fat transfer is being considered. We might have to use some of that fat. So I don't require that people lose weight before they have a procedure if they have weight to lose. And it is a controversy if you're having a fat transfer, because if you lose weight after a fat transfer, you lose the fat that was transferred. So that's an individual consideration, but that's the thought process involved. Now, what also matters is the magnitude of the procedure. How long you wait when there's just a little small mommy pooch is different than if you have to do a whole 360, restoration of the waistline. And a bigger procedure, I might want to see her heal, that 3 to 6 months. A smaller procedure you can consider doing a lot earlier. So the magnitude of the procedure being performed has to be considered as a part of whether it's too soon or not to do a procedure after your baby. My biggest concern is the care of the infant. Now, obviously, mom's going to be going through some changes for a couple of days. You're back to normal activities within 3 or 4 days after one of my procedures. But I worry about who's going to take care of that baby for those 2 days. So that's a question that I insist on addressing as part of the preoperative evaluation. Or if you've got a baby that's home that's 3 or 6 months old, who's going to take care of the baby for 2 days? I want to know that. I worry about the babies too. Now, here are the hard ones. One of the biggest things that I feel body contouring procedures are therapeutic for is postpartum depression. Now, we have some wonderful stories I can tell about women who were just sad and having normal hormonal basis for their depression. But when all of a sudden they look in the mirror and they like what they're seeing, you can do a wonderful job treating depression without antidepressant drugs. So I like to have realistic expectations. I spend a little more time with some counseling, but in the context of postpartum depression, that's almost a reason to encourage the body contouring procedures. And a lot of people are afraid in that context because sometimes folks have unrealistic expectations. They're very negative about their self-image, and they just become difficult patients. But if you wrestle with all those psychological issues, you can get some very gratifying results, and it can be very therapeutic. Now, I also like to know more about the issues that arose during the pregnancy. Preeclampsia or elevated blood pressure, protein in the urine, all those kinds of things. If you had those problems in pregnancy, it's going to make a difference in how we approach your treatment during the liposuction procedure. Frequently, pregnancy is the first time that diabetes shows up. So-called gestational diabetes may have an implication for how you're going to heal postoperatively. I believe diabetes is present long before the diagnosis reaches textbook criteria. So if you had gestational diabetes and you're prone to being a diabetic later on in life, the rare occasions when we see something like an infection, if you dig a little deeper, you'll find that those pre-existing conditions like diabetes were the reason people get minor infections. And therefore, if that was a concern during the pregnancy, I'm a little more aggressive with preventing infection with antibiotics. I'm pretty conservative because most of the time we don't need aggressive antibiotics. But in people who had gestational diabetes, that's a bigger consideration. I like to know if there were kidney problems during the procedure. I've seen a case of nephrotic syndrome where people had issues with how they handle fluid. We do a body contouring procedure. I'm pouring in anywhere from 3 to 6 liters of fluid during your procedure. And we got to know your kidneys can handle that fluid volume, because healthy kidneys, that's no big deal. But pre-existing or pregnancy-related kidney problems, please mention that, because it will make a difference in the approach. I've on just a couple of occasions seen pregnancy-related cardiomyopathy. It hasn't turned out to be an issue as far as the patient post-operatively in my experience, but as a theoretical concern of precipitating congestive heart failure. So there might be a need to be a little more liberal with things like diuretics or other management of fluid, and not allowing the development of congestive heart failure in a person who's experienced that during the pregnancy. The biggest one, in other people's experience, has caused fatalities, has to do with blood clots and venous thrombosis. So if those issues arose during pregnancy, I'm going to wait a little longer post-operatively and intervene and evaluate the status of the venous insufficiency aggressively before doing a procedure. But even when that's the case, we can eliminate the anticoagulants for a couple of days prior to a procedure, reinstitute them within hours of the procedure, and therefore, even in that context, sometimes we can safely perform the procedure. Now, most of the big serious problems that you hear about that we never experience are a function of being inactive or sedentary. So you can prevent a lot of stuff by being more active post-operatively. And if you're healthy enough to have a baby, then you're healthy enough to be active post-op after liposuction. So we don't want people moping and sitting around and acting like a sick person when you've had a procedure. Just being active is a preventative measure that eliminates a lot of the serious complications. So anything that's unique in the way of your own rare genetic or other kinds of problems, medications you may be taking, all that has to be considered as well. But just having had a baby 3 months or 6 months ago is not a reason you cannot have a procedure, assuming you're not breastfeeding and assuming you got somebody to help with the baby for a couple of days. So that's my answer to that question. I hope you'll suggest topics, because all of the topics that come from our patients are the best topics. And if you have a suggestion for future topics, send it to me at info@wisemedicalcenter.com, and we'll include answers to your questions in future recordings. Thank you.
Thank you for listening to the Wise Medical Minute with Dr. Thomas Locke. Dr. Locke addresses current events as well as important medical issues using responsible, unbiased journalism approached from a medical perspective. We invite you to submit questions or comments or suggestions for future topics by email to info@wisemedicalcenter.com. Again, thank you for viewing the Wise Medical Minute.